All right, so migraines are absolutely debilitating. It's something that so many patients come into our clinic for, and we've been dealing with for the last 10 years, helping people with migraine headaches. And it's something I've actually, even though I've never had a migraine before, it's something I've become very passionate about because I've seen how much pain people are in. You know, and for you, if you're someone that deals with migraine headaches, you know exactly what I'm talking about, that it's one of the most debilitating things that you can actually experience. But the good news is that there are answers from it. I know there's a lot of confusion in the medical world on what a migraine actually is, what actually causes it, and at the same time, what the heck do you do about it? And I know if you're someone with migraines, then you've probably tried a lot of different things. You've probably tried the medications, all the way from over-the-counter things like Excedrin to ibuprofens and Aleve, all the way to, you know, the neurological medications. Some people even have been given antidepressants for migraines, and it's something that's it doesn't give you any answers. And if you tried those things, you know it might help you in the moment, but it has not figured out why you actually get your migraines. So today I want to talk to you about what they actually are, why you get them, and then what you can actually do to change that. Okay, and I'm going to start right here with just what the Mayo Clinic has to say about migraines. I really love, one of the things I love doing is going online and reading on the Mayo Clinic, reading on Harvard, actually medical as well, and just learning kind of what they're saying about it, what they're knowing. And it says right here that when it comes to migraines, that they're pretty much unknown. Like, we really just don't know what causes it, but they have some ideas. I'm going to walk you through some of those. But first thing, it says medications can help prevent some migraines and make them less painful. So they know that they can help, but the idea of preventing something with a medication, to me, it seems kind of wacky. Like, it's like, hey, we're going to alter physiology so that you don't get a migraine, instead of saying, okay, why would your physiology be off and why are you getting migraines? And right, so what are you going to take a medication every day just so you never get a migraine? I think that's, even though it's something most people are doing, it's, in my opinion, it's silly because we haven't gotten to the answer. And I'm not calling you silly if you're doing that. I'm simply just saying that let's find the root cause. Let's figure out what is happening in your body. What questions you ask. I always say this, that it's a kind of a shift your thinking a moment right here, that the questions you ask are going to decide the type of answers that you get. So if you have migraines and your first question is, how do I get rid of migraines? Well, you're going to get a very simple answer like, hey, take a medication that gets rid of migraines in that moment, and that's it. But if your question is, why is my body responding this way, creating this extreme pain in my head, and all these other symptoms that are coming along with it, like an aura, maybe even throwing up, things like that, why is my body responding that way? What is happening? What is the stressor that my body is responding to? If you ask that question, then we get better answers, because then we start to investigate. Not just what can I take to get rid of the symptom, what can I do to figure out why my body's doing this, and what can I do to make sure it stops creating this process over and over again, so that 5, 10, 15 years from now, you're not still dealing with migraines and taking worse medications, right? So it says here the medications can be helpful, but it's also lifestyle changes. It says here that one or 2 days before a migraine, you're going to many times experience these things like constipation, mood changes from depression to euphoria, food cravings, neck stiffness, increased thirst and urination, frequent yawning. So we know that there's a body physiology process that's happening, and there's a change that's happening, and you can tell that's a stressor. Some of these things are stress responses right there. It says causes. So this is what the Mayo Clinic says causes migraines. It says, though migraine causes aren't fully understood, so one thing I want to be clear on is no one truly has figured out exactly what causes migraine. Okay, so when they say the science is out, the science is not out on migraines. Genetics and environmental factors appear to play a role. Changes in the brainstem and its interactions with the trigeminal nerve, it's a nerve that comes from up in your brainstem, stems around all the way down the jaw and around the face, trigeminal nerve, a major pain pathway might be involved. So might imbalances in brain chemicals, including serotonin, which helps regulate pain in the nervous system. Researchers are studying the role of serotonin in migraines. Other neurotransmitters play a role in the pain of migraines, including calcitonin gene-related peptide, right? So what that's getting at is there's definitely some neurological things happening. There's definitely some neurotransmitter stuff needs to be addressed here. And the cool part about neurotransmitters, and that's one of the reasons they do antidepressants, because they block certain serotonin pathways. But knowing that neurotransmitters probably play a role in this is very important, because I can tell you that most of your neurotransmitters stem from your gut, right? Your serotonin, your things like that are mostly coming from the digestive system. So there's can be a link from migraines and digestive health. That's a big thing as well to understand. So it says here that there are a number of triggers for migraines, including hormonal changes in women, right? So one of the number one things we help women with is their hormones and making sure they're balanced. So high levels of stress can lead to hormone problems, and then in return can lead to migraines. Drinks, things like alcohol, wine, actually too much caffeine over time can cause migraines as well. Stress, and so stress in general is going to cover all this, that stress is the cause of it, but it might be physical, it might be chemical, it might be emotional stress. Sensory stimuli like too much bright light and things like that. Sleep changes, physical factors, weather changes, medications, actually oral contraceptives and other vasodilators such as nitroglycerin can actually, after that, cause migraines. Foods, right? Aged cheese and salty things, things like that can trigger migraines. Food additives, this is a big one. It says here, monosodium glutamate can be shown to cause migraines. So MSG can actually cause migraines. Now you think of MSG, you think of Asian food, but it's in other things than that. It's a lot of the seasonings that we use, and a lot of people don't realize they're getting MSG when they're seasoning their food with a lot of that stuff. And here's how MSG works. Monosodium glutamate. So you actually have glutamate receptors in the top, in the brainstem area, upper part of your neck brainstem area. And these receptors, when they're overstimulated, it can create literally pain throughout the whole body. They've linked this to a lot of the fibromyalgia issues. And that can happen from trauma. Like boom, you have a car accident and you have trauma to the upper part of your neck, which can lead to migraines. That we see that all the time. Somebody had a car accident, now they have migraines all the time. It's overstimulating those glutamate receptors. Or taking something like monosodium glutamate, which stimulates those overstimulates those receptors as well. So very important to understand there. So it actually is a lifestyle thing. Family history, age, sex, and hormonal changes all play a role in this. Now, I do want to add this one last thing that they have on here. It says complications. So they talk about Excedrin, they talk about ibuprofen, because I know most of the patients that come in for migraines are taking an ibuprofen regularly or Excedrin regularly. So this is important to know. It says taking combination painkillers such as Excedrin migraine for more than 10 days a month. I know people that take this on a daily basis with migraines for 3 months or in higher doses can trigger serious medication overuse headaches. So it actually can cause you to have more headaches if you're taking it regularly. And they say for more than 10 days, hey, that's a generic that's a broad spectrum recommendation, meaning everybody's an individual. So it might be less for you, it might be more for you, but just understand that it actually can lead to medication overuse headaches. Same goes true with aspirin and ibuprofen. I know people take ibuprofen every single day. I had actually a good buddy of mine, Jonathan Rape, who does the podcast with us, the Becoming Your Own Health Expert podcast, or Owning Your Health podcast. I got to learn the name of my podcast. That's good. But Owning Your Health podcast, he actually shoots this with us, but he came into our clinic in the first place with headaches. And he was taking an ibuprofen almost every single day. Right, so that's a big deal. Okay, medication overuse headaches occur when the medication stops relieving pain and begin to cause headaches. So point is that taking a medication isn't going to be the long-term answer for you. It might help you in the moment, but we got to figure out the right question, which is why is your body responding that way? And I want to help you with that. So my experience has been in the last, first of all, understanding that you go to your doctor, your primary physician has about 2 hours of migraine or headache studies, and a neurologist has about 4 hours of headache studies. So let me just say that again. The doctor you're going to has about 4 hours of headache studies. And their most common answer for migraines is a CAT scan. I've shown that 1 out of 11,000 CAT scans for migraines actually has a tumor, meaning it's rarely the problem, but it's an overuse thing and you're getting a massive amount of radiation. So instead of going in that direction, let's go to someone that focuses on migraines, someone like myself, a chiropractor that spends most of their time focusing on the upper cervical neck. We talked about how overstimulation to the brainstem, they talked about that in the Mayo Clinic. Overstimulation or problems in the brainstem can cause trigeminal nerve pain. It can cause glutamate receptors to be overstimulated. It can also create blood flow issues to the brain. I'm going to show you this right here. Look, so we got the upper part of the spine. Look at this. So you got a neck, okay? You see this red thing? Or it's on this side. So you see this red thing right here? That goes through your atlas. It goes to the top bone in your neck. You can actually see the hole right there, okay? So it goes right through that hole right there, okay? This is cool. Got the focus going there. So that vertebral artery is the blood supply to your brain, okay? It's the main blood supply to your brain. It goes through that top bone in your neck. If that atlas bone isn't moving properly, if it's subluxated and moving properly, or if it's shifted out of alignment, you can actually have alar ligament damage from car accidents. We'll shift that out of alignment, and it can actually create spasming in that artery, create lack of blood flow to the brain. That's a major way you can start to get migraines. It also can irritate the brainstem. It can cause overstimulation or messing up the brainstem. It can also affect the vagus nerve, which is your parasympathetic relaxed response. Does that make sense? It actually puts your body into a stress response, and it said there in the Mayo Clinic that stress is one of the main causes of people getting migraines. So with chiropractic here, the first thing we do is we take x-rays and we evaluate the upper cervical spine and then start to adjust the spine. And I'll tell you this, that we do food allergy testing, we do stool testing, we do all kinds of other testing, but I'll tell you the one main thing that we've seen more migraine headaches go away with than anything else we've done, and we do a lot of different things, is adjusting that part of the neck. That's number one go-to with migraines, because it's literally about 95% of getting rid of headaches just by getting the spine moving. So if you're someone with migraines and you haven't been to a spinal corrective chiropractor and done a series of processes of care that's focused specifically for you, I don't know what you're doing. Like, I get some people are a little nervous about chiropractic and things like that, or they've been lied to by the medical community about chiropractic, but not only is it incredibly safe, it is extremely effective. I've been doing this for 10 years and I've seen more changes from adjustments to the spine and the neck than anything for migraines. So your number one thing to do if you have migraines is go see a good chiropractor. You can go, if you want to see us, go to queencityhealthcenter.com and schedule an appointment time. If you want help finding a good chiropractor, simply message us and we'll find you one. But it's key, we got to get this moving. Okay, so that's number one thing to understand is headaches, upper cervical, all headaches, but specifically as we're talking about migraines today. The next thing that I would say that we do right off the bat is food allergy testing. It said right there in the Mayo Clinic website that foods can play a role in this, and what your body is responding to, what foods are creating stress in your body may be different for you than somebody else. I have a story, a patient named Ashley who actually came in and she had migraine headaches and some other health issues going on, and we've helped her with a lot of these issues, and the headaches have decreased probably 75% with just getting adjusted, right? 75% she was having them daily, 75% gone, but they're still lingering. And so we did food allergy testing, and one of the things I had her do is take magnesium, but I also had her eating foods high in magnesium, like cacao, right? Cacao is amazing for a lot of people with migraines. However, for her, on her food allergy test, she was allergic to it. So it would actually cause her to have more migraines. So by getting these food allergies out, we're able to decrease migraines even more. So her migraines would decrease even more after taking out food allergies. The next thing we do is we do a stool test to see, remember, serotonin levels, neurotransmitters, those are all things that stem. 80% of that comes from your digestive system. So let's test your digestive system. Let's see if you're having yeast infections, bacterial infections. Maybe you have a parasite. That's very common with extreme migraines. Maybe you're someone that just isn't breaking down your food because your microbiome is all destroyed from too much antibiotic use or too much vaccines or things like that can really destroy our microbiome, or eating poor diets. So then we evaluate the digestive system with a stool test. And so now you have spinal care, your spine's moving again. Now you have removing foods that create stress, more stress and inflammation in your body. Now you actually look at the gut and we start to work on healing up your digestive system. Those three things right there, that's it. That's not it, but that's the start. And then, at the next step, I've had a patient, this one reminds me as well, is that we did those three things, but we couldn't figure it out. And the next step was we started to evaluate her lifestyle and what she's lived in, and she's been around tons of mold over her lifetime. And so the next step is we're going to go through a detox to start detoxify the liver. That's huge. Detoxifying the liver. I've had patients that have had their gallbladder removed, and we started giving them ox bile to break down fats. Their migraine headaches went away. It's all lifestyle. So it's investigating is my point, is that if your doctor is simply saying, here you go, take this, get a new doctor. Right? That might help you in the moment, but you need to find someone that's actually going to investigate you and figure out what is causing your body to respond the way it is. I recommend going to thewellnessway.com, thewellnessway.com, and find yourself a doctor in your area. You can come see us. If you want to get directly to us, you go to queencityhealthcenter.com. But the key is find answers. If somebody's not telling you what's causing this, or at least investigating deeply for you instead of and investigating isn't trying a different med. Just so you know, that's not being a doctor. If you go to a doctor and you're like, doc, this medication isn't working for me. Okay, let's try this one. That's not being a doctor. That's being a drug dealer. Let's be honest. If I had a coat full of meds and I just said, yeah, pick that one. Come on. Let's actually investigate and be doctors. And then, you know what the definition actually of a doctor is? It's a teacher in Latin. It means teacher. So your doctor should be teaching you to not only change your lifestyle, but about your body, how your body works, and what you can do to take care of it on a long timeline. So after we figure out what's causing your migraines and we get rid of your migraines, then you actually start to make drastic changes in your health, but you keep them going so that you become your own health expert. So guys, that's it with migraines, is really figuring out the answer and finding the cause. And I highly recommend start following us on some of the bigger avenues, like, or not bigger avenues, other avenues that we have, like our podcast. We have a podcast called Owning Your Health. We just talked about migraines on there, but we're talking about all kinds of topics, everything from digestive health to how lifestyle, what kind of lifestyle do we live, how do we live that lifestyle, what we do for our kids. We talked about ADD, ADHD last week as well. So engage in that too. Go to Owning Your Health on any of the podcast channels, and you can watch us there. Also, go to queencityhealthcenter.com if you want answers for your health and you want us to help you individually. I'm happy to jump on a phone call with you and see how we can help. And yeah, just continue to connect. Make sure you're connecting with us on Facebook. And hey, that's it on headaches. So I hope you got a lot out of that. Make sure you share this with friends. One of the worst things is when I see patients coming in taking all these drugs and they're just miserable with migraines, when all it took was a few adjustments, or it took a food allergy test or something like that, and it changed their life completely. So take action, share this with people, and join this kind of mission with us to change people's lives. You guys have an awesome day. Hey guys, thanks so much for watching this video. If you want to connect with us and learn more, we're constantly shooting information or shooting videos. We actually have a blog as well, and we have a website where you can learn so much more. If you want help with your health, you can actually connect with us, come into our clinic, or jump on a phone call with us and see if we can help you. To do that, go to the links below in the information area and click those areas, and then you can move forward and see how we can actually address and help you with your health issues as well.